Hello, I'm Randall Leary, President of Northern Light Eastern Maine Medical Center. On behalf of our caregivers and staff, I'd like to welcome you to the Medical Center. Our entire team is committed to guiding you through your hospital experience and providing care that reflects your individual needs. Simply put, we want to make healthcare work for you. The scenes that followed were captured prior to the arrival of COVID-19. When you come to Eastern Maine Medical Center today, things will look a little different. When you arrive, you will notice several enhanced safety measures that we've implemented to keep you, your loved ones, and our staff safe. Precautions we've taken include screening for symptoms of the virus and exposure, social distancing, and requiring face coverings to be worn in all areas at all times. Rest assured, you are in good hands with our highly skilled, compassionate caregivers and staff. And thank you for choosing us for your health care.
Eastern Maine Medical Center has cared for generations of Mainers since 1892. With 411 beds and several outpatient locations in Greater Bangor, we provide highly specialized care that's not available anywhere else in the northern two-thirds of Maine. We know that you may have questions about your surgery. This video will explain what will happen before, during, and after your procedure. Allow us to show you how we will support your surgery. Preparation is key to a successful surgery. Our surgical navigation team will help you prepare for your operation and make sure your care team has all the information they need to keep you safe and comfortable. Several days before your surgery, a surgical navigation nurse may call you to review your health history, confirm your date and time, review your pre-surgery instructions, and answer questions you may have. Depending on your type of surgery, you may have an in-person appointment with surgical navigation. This information will help us keep you safe during surgery and determine if other tests, such as lab work, are necessary. Don't hesitate to ask your nurse any questions you may have during your phone call. Your safety and comfort are our top priorities. In the days before surgery, please arrange for a responsible person to bring you to the hospital on the day of the operation, receive your discharge instructions, and drive you home after surgery. Please also arrange for someone to stay with you for 24 hours after surgery. Registering prior to surgery will lead to a smoother process on the day of your procedure. If you have not connected with registration prior to surgery, please call 207-973-8900 between 7 a.m. and 7 p.m. Monday through Friday. It's the day before your surgery, and you've talked with a surgical navigation nurse, registered for surgery, and arranged for transportation to and from the hospital. You're well on your way to a successful operation, but there are a few other things you'll need to keep in mind in the hours leading up to your procedure. The following reminders will help you have a successful surgery and minimize the chance of complications. 24 hours before and after surgery, please do not drink alcoholic beverages. Adults and children 5 and older should not chew gum, eat candy, or eat any kind of solid food the night before surgery or the morning of surgery. It's okay to drink a small amount of apple juice, water, black coffee, and black tea until 2 hours before your surgery unless instructed otherwise. It's important to follow these steps carefully in order to ensure your safety. Otherwise, we may need to reschedule your procedure. Children under 5 should not have candy, gum, soup, or solid food after midnight the night before surgery or the morning of surgery. Small children scheduled in the afternoon may have dry toast or crackers until 8 hours before surgery. Infant formula or cow's milk may be given up to 6 hours before surgery, and breast milk may be consumed up to 4 hours before surgery. Small amounts of apple juice, water, and Pedialyte are okay until 2 hours before surgery. If you're taking medications, your surgical navigation nurse will tell you whether to take them the day before and the morning of surgery. You may be asked to wash with a special soap on the day before surgery. Your surgical navigation nurse will tell you if this is necessary, and if so, will review instructions with you. It's natural to want to arrive looking your best, but you're having surgery, so give yourself a break from your everyday routine. Please do not use scented deodorant, scented skin cream, perfume, cologne, nail polish, or dental adhesive. Visiting family, caregivers, and friends should also avoid wearing scented perfume or cologne. Please do not wear jewelry of any type, including body piercings, to the hospital. Wear loose, comfortable clothes and shoes, and don't worry about bringing a change of clothing. Bring cases for your glasses, contact lenses, dentures, and hearing aids, and give them to the person who is accompanying you on the day of surgery for safekeeping. You will not be able to wear these items during surgery. Finally, please bring a list of medications you're currently taking. If you're using an inhaler, please bring it with you. If you use a CPAP machine and will be an inpatient after your surgery, please bring that with you too. Otherwise, please do not bring medications unless asked to do so by our staff. Northern Light Eastern Maine Medical Center is located at 489 State Street in Bangor, on the banks of the Penobscot River. Our main entrance is on Hancock Street. If you're coming from I-95 and Hogan Road, past the first stoplight in front of the hospital, and turn left at the next stoplight onto Hancock Street. The hospital entrance will be on your left. Continue to the main entrance for valet parking, or park in the parking lot that's on your right as you enter the hospital driveway. You may also park in the parking garage. The entrance to the garage will be on your left as you drive into the hospital. Valet parking is available at the main entrance from 5 a.m. to 5 p.m. Monday through Friday. There is no charge for valet parking. After you park, enter through the main entrance and proceed to the elevators at the rear of the lobby. If you need assistance with directions or a wheelchair, please stop at the information desk just inside the main entrance. We'd be happy to help with anything you might need. Take the elevator to level 3 and follow the signs to Surgical Patient Reception. Our receptionist will welcome you and check you in. If you have any questions on the day of your procedure, please call the reception desk at 207-275-0939. We do everything possible to keep your appointment time, but sometimes we must make last-minute changes to the schedule. Please make sure we have your alternate contact information so we can keep you informed of any changes. For your health and safety, tobacco use, vaping, and smoking of any kind are not permitted inside or outside the facility. Our tobacco and smoke-free policy applies to patients, visitors, staff, medical staff, and volunteers. Please ask your provider about tobacco and smoking cessation resources at any time. When you arrive at Surgical Patient Reception, the receptionist will let your care team know that you've arrived. You will be taken to the pre-op area, where you will meet with the anesthesia provider and other members of your team. They will ask you several questions and take your temperature and blood pressure. A family member, caregiver, or friend may join you in the pre-op area. If you desire, your guest in the pre-op area may help you with dressing or undressing. Pediatric patients will be accompanied by a parent or guardian in the pre-op area and will stay with the child until they are ready for their procedure. Hand hygiene is one of the most important ways to prevent the spread of infection. Your care team washes their hands and uses hand sanitizer to keep you safe. And we ask patients and visitors to also clean their hands. For your safety, you are welcome to ask your caregivers to wash their hands at any time. We want you to fully understand every aspect of your care. If you are uncomfortable or have any questions while in the pre-op area, please let a member of your care team know right away. When it's time for your surgery, a member of your care team will bring you to the operating room. You may see a lot of equipment in the OR, and your care team will be wearing masks. It is an unfamiliar place for most people. Feel free to ask any questions you may have about the room or equipment. The operation room may feel cold. If you are cold, let us know. We're happy to bring you a warm blanket. Your family member, caregiver, or friend will be updated regularly when you're in surgery. They can also follow your progress on the surgery update monitor in the waiting room. To protect your privacy, you will be assigned a number that only your support person and the staff will know. Your name will not appear on the monitor. A guest Wi-Fi connection is available at no cost. You will not be required to enter a password to use this system. For the privacy of our patients, visitors, and staff, please do not take photos or video anywhere inside or outside of the facility. Please ask your nurse, a patient experience representative, or the supervisor on duty if you have questions or concerns. When your procedure is over, you'll be brought to a recovery area. A nursing team with special skills in post-surgical care will monitor your safety, vital signs, pain level, and alertness and comfort. In the moments after surgery, for your safety, your care team will focus their full attention on your care. Once you get settled in recovery, up to 2 family members, caregivers, or friends may join you. We'll let them know when they are able to come see you. Parents of children who are having surgery will be brought into the recovery area as soon as possible. When it's time to go home, a member of your care team will review your discharge instructions with you and your support person. There's a lot to cover, so we encourage you to take notes and ask questions. Your discharge instructions will cover how to take care of yourself when you get home, follow-up appointments, prescription medications. If you do not know the name or purpose of any of your medications, please ask. How long until you'll feel better and when you can resume normal activities. And any treatments that need to be performed at home, including how to care for your surgery site. A responsible person must drive you home and stay with you for 24 hours after surgery, as you may not remember your post-surgery instructions because you were sedated. If you will need to recover in the hospital, you'll be brought to your room by a member of the care team when a bed becomes available. The team that will take over your care will have the training and expertise to provide you with excellent care and meet your physical and emotional needs. Our goal is to exceed your expectations during your entire visit and make healthcare work for you. Your feedback will help us provide the best possible care to all our patients, including you and your family. Several days after your visit, you may receive a survey in the mail from our partner, Press Ganey, with questions about your experience. This survey is confidential. Thank you in advance for taking a few minutes to answer the questions and return the survey in the postage-paid, self-addressed stamped envelope. We appreciate your feedback. Thank you for choosing Northern Light Eastern Maine Medical Center for your care. We hope this video has been helpful in preparing for surgery and understanding what you can expect every step of the way. If you have questions, don't hesitate to ask your doctor or a member of your care team at any time. Once again, welcome to Northern Light Eastern Maine Medical Center. It is our privilege to serve you. Best wishes for a full recovery and a return to good health.